Now let's talk about the malignant types of WBC abnormalities. Primarily, malignancy involves the bone marrow and the peripheral blood, where it is classified into three main types of malignancies: leukemia, myeloproliferated neoplasm, and myelodysplastic syndrome. Now, what do you mean by leukemia? It is the uncontrolled proliferation of specific WBCs that may either be acute or chronic. So we will go in detail about each of these conditions, the different types of leukemias. Now, myeloproliferated neoplasm, what does that term mean? It is a spectrum of disease resulting from an abnormality of the stem cells. Okay, specifically the stem cells. This neoplasm has a variable blood picture as the disease progresses and may finally result in acute leukemia. If it is untreated, it ultimately progresses and ends up into leukemia. Third one is myelodysplastic syndrome, which is a decrease in all the WBCs, RBCs and platelets in the peripheral blood due to the stem cell defect. Now, initially what we talked about leukemia, which is an uncontrolled proliferation of your WBCs alone, and which can be either acute or chronic. Acute leukemia, what do you mean by that? It is the mutation that causes maturation arrest in a blood cell in the early stages of development. So the cells that have to be formed fully matured, it doesn't form matured, and they are called as blast cells, which are the most immature stage of a cell type, accumulating in the bone marrow and the peripheral blood also. These blasts replaces all the cell types in the bone marrow, and if untreated will cause a rapid death of the patient. The key feature in the WBC differentiation is the presence of blasts. Normal WBC, RBC platelets will be decreased because they are all replaced by the immature blast cells. Acute lymphoblastic leukemia. There is a different types of acute leukemia varuna lymphoblastic leukemia, usually which occurs in young children, and acute myeloid leukemia, where it affects mostly in infants and older adults. Now, the chronic type of leukemia, they are slower proliferation and accumulation of mature cells within the bone marrow itself and the peripheral blood. And the type of chronic leukemia is chronic lymphocystic leukemia, which is commonly seen in elderly people. Now, the second type, myeloproliferated neoplasm, is a chronic myelogenous leukemia, CML, chronic myelogenous leukemia, occurring mostly in mid-aged adults. It is caused by a mutation in the stem cells, resulting in uncontrolled proliferation of your granulocytes. Okay, that is your base of his eosinophils and neutrophils. WBC count is increased in bone marrow and peripheral blood with increased number of immature neutrophils in all stages of maturation, as well as your basophils and eosinophils. Platelets are increased. There is progressive anemia without the treatment of CML. It will terminate in acute leukemia known as blast transformation, that is into immature cells transformation. It will ultimately end up into acute leukemia. Now, another variations of neoplastic WBC abnormality are polycythemia vera, which is characterized by proliferation of granulocystic, erythrocytic and platelet precursors in the bone marrow, and increase in the WBCs, RBCs and platelets in the peripheral blood. Myelofibrosis are characterized by defective hemopoiesis caused by executive growth of fibrous tissue or fibrosis in the bone marrow. Essential thrombocytopenia involves excessive proliferation of karyocytes and increased platelets in the peripheral blood. And the last one, your myelodysplastic syndrome. They are stem cell mutation causing ineffective blood cell production, resulting in decreased WBC, RBC and platelets in the peripheral blood, usually predominantly seen in elderly patients. So these are all the malignant type of WBC abnormalities. Now we have spoken about your WBCs, the functions of all the cells, granulocytes and agranulocytes, the non-malignant types of WBC abnormalities, and as well as the malignant type of WBC abnormalities. Next we will go on to your RBCs.